Welcome to Kent District Library's YouTube station. And we're going to be meeting today with Dr. Maureen O'Keefe from Purple Mountain Physical Therapy. And she's going to talk to you about women's pelvic floor health. And welcome. Good to see you, Maureen. All right, so I'm going to let you take over and we'll have you share your screen. Did you have anything you want to talk about before we get to the screen sharing?
I want to thank you for being here and the opportunity to talk about pelvic health and diastasis recti abdominis for women. This is a huge area where there's seem to be a lot of questions and uncertainty, and it is my field. I've been doing this for almost a quarter century, and I love this work. So hopefully today we can answer some questions that people might not even have known they had.
That's wonderful. Thank you so much. Take it away.
All right, thanks. Hello, everybody. Okay, we are doing a screen sharing. There I am. So today I'm going to be speaking to you about pelvic health and diastasis recti abdominis and how you would possibly recover your core and your pelvic floor. So us women go through a lot when we become mothers. We experience a complete change in our body in order to have the baby or babies within us. And as a result of that, it's quite common, as you know, that we may experience some problems with bladder, bowel, or intimacy afterwards, or even during pregnancy. And you may experience some problems with pain, such as back pain, SI joint pain, pubic pain, abdominal pain. And something that is a common problem that individuals come to me about or ask me about is whether they have a diastasis recti abdominis. And if they do have it, is it contributing to some of their pelvic floor dysfunction? So we're going to be talking about that today. My background is in physical therapy for over 2 decades. I have been focused on pelvic health since the 1990s. I was in Chicago practicing for 20 years and then moved here to Grand Rapids and opened up Purple Mountain Physical Therapy in the Cascade Forest Hills area. My mission is to provide excellent care that's therapeutic and healing to the men, women, and children I treat. So we do work with men that have a diastasis recti and women and children. So what I'm speaking to today is something that every person might experience, even though a lot of my focus today will be regarding moms and pregnancy and postpartum recovery. If a person wanted to learn more or feels they need pelvic health physical therapy, you can always reach out to me through my website and ask any questions. So the first question to begin with is, what is a DRA and is it something important? This image here does show a pregnant belly expanding. As the baby grows, the abdominal wall needs to create space for that baby. And it's very common that a diastasis recti abdominis would occur. This picture over here on the left is a person who has, you can see there's quite a bit of width at the belly button and even above the belly button. That width is diastasis recti abdominis. Just the fact that she has that width doesn't tell us that it's a problem. We would need to be doing a more in-depth evaluation to see if it's a problem or not. So if your abdomen looks similar to this image on the left, don't worry, it might be okay for you. So the diastasis recti is a widening and thinning of the linea alba. The linea alba is the collagen between the two abdominal muscles. In the research, we have found that 66 to 100% of pregnant people experience a DRA. I would say it's 100%. I've been checking people for DRAs consistently since 2005. And during pregnancy, especially that third trimester, our abdominal wall needs to expand to allow for this baby to happen, to grow. And the DRA is a consequence of that. So the fact that you have one, or you did get one during pregnancy, or have it postpartum, I would call that normal and not alarming. But it is something that we need to recover and rehabilitate so that you don't have ongoing problems. One thing that is not good if you have a DRA is if you notice that you have doming or caving in your abdominal wall when you try to move. So women will tell me that they move, they pick up their baby, or they roll around in bed and their abdomen looks pregnant and it totally bulges out. We don't want to see that. That can be a sign that your diastasis recti abdominis is not transferring load effectively through your body. And it may place you at increased risk for other problems such as back pain, pubic pain, abdominal pain, pelvic organ prolapse, or loss of urine. So the postpartum rates of diastasis recti do vary in the literature, but we know that it's running about 40% of women at 6 months have this. So 60% of women at 6 months postpartum, it should be recovered, but 4 in 10 women, it tends to not have recovered effectively. And those are the people that we definitely want to get into physical therapy to help foster and facilitate your recovery. We have very good evidence and knowledge of how to do this and how to teach you to do this so that your linea alba can recover strength and capacity to load transfer. So why do we get it in the first place? I already mentioned the growing baby, but I've also mentioned that men can have it and children are actually born with it. But there are some things that may influence your capacity to get it. First would be hormones. We know that there are some softening effects in the connective tissue and in the linea alba with progesterone, estrogen, and relaxin hormones. There's also mechanical strain that happens through the linea alba. That means you're lifting and moving a lot. You might not be doing it very effectively. The baby's car seat and the baby is quite a load for a lot of us, and you may have just simply strained the linea alba. If a person experiences multiple pregnancies close together, it's quite possible they did not fully resolve the DRA after the first pregnancy, and now you're putting another baby to stress and strain that area. So that's a risk factor for an ongoing DRA. And we do know in pregnancy, there is a 115% increase in your rectus abdominis length. So that means your abdominal muscles, those six-pack muscles, they like get super duper long. And that is something that stresses and strains this linea alba. When the muscles are long and stretched out, they can be weak and that can cause problems. So if you have a DRA, what types of problems might you have? You can have that mommy pooch. You can have posture problems where you're feeling like you always slouch and it's hard to hold yourself up. There could be trunk stability problems where I've worked with individuals whose SI joint always goes out, or they have on and off pubic bone pains. Interestingly enough, you may have some compromised breathing. So that you may, if you are somebody who feels like, gosh, I can't take a deep breath like I used to, it's possible that your abdominal wall has some issues with it. And if that's the case, then you would also have pelvic floor dysfunction because they tend to go hand in hand. You can also have some problems with constipation and bowel movements if your abdominal wall is disrupted. You may have some challenges to your visceral support, meaning your organs, so that pelvic organ prolapse, which is listed down here, might be more readily possible. Of course, there's low back pain, pelvic floor dysfunction, urinary incontinence. It is much easier to lose your urine when you're jumping and laughing and coughing if your abdominal wall has this separation. So the question a lot of people ask me is like, well, what is normal? How far apart should my abdominals be? What isn't a good distance and what is a perfectly fine distance? Generally, about 2 centimeters apart is the normal finding. We tend to measure that with how many fingers we can put in between the abdominal muscles. And usually approximately 2 fingers is or less is the maximum of normal. Postpartum, we routinely see people that have 3 or 4 fingers, and I myself had 4 fingers and also some abdominal wall problems on one side. That was not fun, but I'm completely recovered from that because I did all the work that's needed to recover it, and I know how to do it. As I said, I've been doing this work for over 2 decades with patients, and personal experience also informs a lot of what I do for people. If a person is 6 months postpartum, we go back to you should be in this 1.7 to 2.8 centimeter range. Once you're beyond that, the width, if it's bigger than that, is too much. And usually there is the load transfer problems. In the first 4 to 8 weeks, your linea alba should be coming back together for you postpartum, and we want to see and encourage that to happen. I can teach people the proper body mechanics and exercises to do to try to encourage that. Things that you would want to look for on yourself to see if you have that is the width that I was talking about. So you've got these abdominal muscles, and you really shouldn't be able to put a ton of fingers in between those muscles. 2 fingers is the width at most that we want to see. The other thing you can check for is what is your load transfer capacity. Literally lift up your shirt and look at your abdominals when you're doing certain twisting, turning, lifting motions and see, do you have this like doming going on where everything pooches out? Or the opposite, do you have everything cave in? Because we don't want that either. When a person comes to me to get assessed, I'm also checking for their connective tissue integrity. It does take more of a professional eye to look for these things in terms of depth and the tension under passive load and active load. All right, if you have overstretched abdominals, those muscles will also contribute to you looking like you have a mommy pooch, even though you might not have a diastasis recti. When a person has overstretched abdominals, again, they'll have the compromised posture, they have trunk instability, the taking the deep breath can be compromised. Having a vaginal delivery can be hard because you don't have the abdominal muscles to help facilitate getting the baby out. Pelvic organ prolapse might happen, urinary incontinence, and constipation. We know all of us, when we have a baby, our muscles get overstretched. That is what needs to happen. So that's normal. And we know that the diastasis recti will happen. So that's normal. But we want to keep our fitness and our body mechanics as optimal as possible so that we don't experience all of these problems with posture and pain and incontinence. So what am I talking about when I speak to effective load transfer? Load transfer means the load that you are putting through your body as you're moving needs to be able to transfer from one side of your body to the other. In this graphic, the woman and the little girl are running. And so she, right now, her right leg is on the ground, this woman's leg. She is taking a load, ground reaction force, up from the earth, up through her foot and ankle, her knee, her hip. That load goes through the back and the core. It transfers through this diastasis recti area into the left side so that the left leg can now hit the ground and continue running or walking. That is a load transfer from the right side to the left side. And if a person has a problem with that load transfer, they will have this doming or caving or the problems that we talked about with the area not feeling good. So why does a pelvic floor physical therapist care so much about a DRA? Well, first, diastasis recti is actually one of the most common questions I receive. It's very, seems to be very well known in common popular media these days, and women will tell me quite often with their first phone call that they think they have a DRA, or they know they have a DRA, they've had it for years and they can't get rid of it, and can I help them? So the Diastasis Recti Abdominis recovery is the specialty within the field of pelvic health, but pelvic floor dysfunction is really my true specialty. And pelvic floor is an assortment of muscles at the bottom and base of your pelvis. These muscles help support your organs, meaning your bladder, your uterus, and your bowel. And if you have compromise to those muscles, the support to those organs is not as great. So you could experience a sense of something falling out. You might experience that you have like a bulge down there, or just a general heaviness and pressure vaginally. That is a symptom of pelvic floor dysfunction. Also, when the muscles are dysfunctional, it causes bladder problems. So the problems might be that it could cause you to have stress incontinence, where you lose urine when you laugh, cough, or sneeze. Or it could be urge and urgency and frequency, where you're going to the bathroom all the time. If you are someone who believes that your bladder is smaller than your friends and that you're the one who has to go to the bathroom all the time, that would be a sign that you could potentially benefit from pelvic health physical therapy. If you are unable to do jumping jacks, or you're laughing, or you're talking loudly across a room causes you to lose urine, that isn't normal. And there's super good help out there to help restore your pelvic floor muscles. When the pelvic floor is dysfunctional, it often doesn't allow the muscles to either relax and open up the gates so that you can pee and have your bowel movement, and it doesn't allow the muscles to tighten up and close the gates so you can hold in your urine and hold in your gas and your stool. So when people have pelvic floor dysfunction, sometimes they're not emptying their bladder all the way. They will tell me that their urination starts out normal and then it just peters off, and they didn't really finish, but it all stopped coming out. So they leave the bathroom, but they still feel like they have to go. That is a sign of pelvic floor dysfunction, and we can get that way better for you. With the back pain, hip pain, and SI joint pain, this is interesting. So for anybody watching who has ongoing back pain or SI joint pain or hip pain, one of the things that our research has been very clear to identify in terms of what's going on with someone who has back pain that won't go away is that one thing that is going on is your pelvic floor muscles. There's a very high chance that they are dysfunctional. So it's quite common that I'm working with individuals that have had many other treatments from other providers over the years for their back, hip, or SI joint. They've gone to sports physical therapists or orthopedic specialist physical therapists or chiropractors or massage therapists or anyone. They've gone to physicians who provided injections, and they've always gotten good care, but they can't shake off their pain. And when I treat them, my first specialty was in back and neck pain. So I have a complete capacity to treat anyone's neck and back pain. And when I treat somebody's back pain, I am always assessing their pelvic floor, as long as they're comfortable and agree to that, because chances are high that the pelvic floor is not good and contributing to the capacity to have ongoing back pain that will not get better in spite of all the other good practitioners that you've gone to and all the other methods. Remember, when a person has back pain, we're always talking about you need to have a strong core. Well, your core muscles are your diaphragm for breathing, your pelvic floor, your abdominal muscles that we're talking about with this DRA, but also the transversus abdominis and the obliques, and your back muscles. So because your pelvic floor muscles are part of your core, it is important that if we want to restore back pain or hip pain or SI joint pain, we need to restore all of those areas. If you are experiencing urinary incontinence unexpectedly with things like laughing, coughing, sneezing, speaking loudly across a room, your body needs to learn to control intra-abdominal pressure. So intra-abdominal pressure is just a fancy way of saying, like, you need to learn how to control to keep everything inside, even when the pressure that's placed on your abdomen goes up because you're coughing or laughing. One of the muscle groups that helps control that pressure is your deep core muscles. So what we find with people is that those muscles are not working effectively for them and are contributing to their pelvic floor dysfunction and all of their symptoms. So that is a particular abdominal muscle called your transversus abdominis. It is called the transversus because it actually runs kind of east-west across your lower abdomen. And it is the deepest abdominal muscle that helps stabilize your spine and helps you control intra-abdominal pressure. It works with the pelvic floor muscles and with your diaphragm. Your rectus abdominis and your obliques are other abdominal muscles. Those are important. And when you come to a good pelvic health physical therapist, we will assess all of your abdominal muscles to see how they are working for you, because it's very common that we will see too much obliques. And if you have too much obliques, that can potentially worsen your diastasis recti, and not enough transversus abdominis, and an elongated rectus abdominis. So we've got to balance out all of the abdominal muscle firing and strength and conditioning in order to get your pelvic floor dysfunction to improve, and in order to improve your ability to control your intra-abdominal pressure so you're not leaking urine or gas unexpectedly. So here's the question: what exercises may help reduce a diastasis recti abdominis? I love having giving this presentation in person because we have so many fun conversations about this. And you remember I told you that I had a diastasis recti myself and I rehabilitated it. I did so many exercises. But since I had that problem, there has been so much more research that's been published that has taught us how to even more efficiently address your diastasis recti abdominis. So if you're Googling and you're reading online what to do and what not to do, chances are high that the exercises that you're being told don't do are incorrect advice. You will commonly hear things, or you might read that if you have a diastasis recti, you should not do a plank. And they will put scary language in there telling you that your intestines are falling through the hole in your abdomen, and so don't do a plank. That has been debunked, not true. You will also read, if you have a diastasis recti, do not do crunches. Crunches are terrible for you. It's going to split apart your abdominal wall and make the problem worse. That has been debunked, not true. So what we have found is actually when pregnant, doing some abdominal exercises can potentially help preserve and stabilize the diastasis recti. And in postpartum, we do want you to be doing exercises. It is okay to do crunches. I know people are going to hear this and they're going to say, like, she's saying do crunches. I'm telling you, that's what the research shows. And I check all of my patients to see when they do crunches whether their diastasis recti gets better or gets worse. And I'm going to tell you, just about everybody, it gets better. Okay, so here's the slide on should they do crunches versus transverse abdominis exercises. Yes, you should be doing crunches, even when you're pregnant, if you're okay lying on your back. Some of us, it's not okay to lie on your back at all. So then you would modify this so you are not lying on your back. I already mentioned that if you exercise during pregnancy, you may be able to preserve and stabilize your diastasis recti. That is coming straight out of the research. Here's a statistic. If you do not exercise during pregnancy, in this one study, 90% of the people in the study did have a diastasis recti. For those who did exercise during pregnancy, this is only one study, Only 12.5% of the people had the diastasis recti. So if you are wanting to work out and interested in working out, it is good for you and good for your baby, as long as your doctor has cleared you for this and that you're not high risk with some of the things that would tell us that you shouldn't be exercising. Benefits of strengthening during pregnancy. It helps us improve our posture. That baby is pulling the abdominal wall forward and putting so much strain on our back. We don't want to lose the alignment of our body. Obviously, when we strengthen in pregnancy, we are strengthening muscles that we'll use for labor. Labor is a workout. It can take hours, and you want to have conditioning so that you can do that. During pregnancy, there is some evidence that if you exercise, it may prevent you from having low back pain. And also I mentioned that there are benefits for your abdominal wall. So which exercises are safe to do, whether postpartum, pregnant, or even if you're a man? It really depends upon your starting point. That's where a good pelvic health physical therapist will be looking at your abdominal wall to see how it is load transferring, to see if it's doming and caving, to check the depth and the integrity of your linea alba. If you're somebody who does exercise already, I would say do the exercises that you're currently doing that you know are safe for you, that don't harm you, and lift up your shirt periodically and look at your abdominal wall. If it's pooching funny, if it's doming or caving, you shouldn't be doing those particular things. Okay. Now, this last slide is just how you can work with me. My company is Purple Mountain Physical Therapy. You can find out more information about pelvic health PT or diastasis recti at my website, which is www.purplemountainpt.com. You can feel free to call the clinic at 616-516-4334, or you can email me directly at mokeefe@purplemountainpt.com. On December 6th, 2021, I am offering a free screen for a diastasis recti abdominis between the hours of 12 and 2 p.m. And that would be here at my clinic located at 847 Parchment Drive Southeast, Grand Rapids, 49546. That is by appointment only. That would be a 20-minute slot to examine people to see if they have a diastasis recti and give you an idea of whether you have it or not, and some suggestions for how you can manage that. But I love working with pelvic health, women, men, or kids. And if anybody has any questions and is wondering if I may be able to help you, reach out at any time, because it's great joy for me to be able to empower people to feeling more like themselves. Thank you so much to the KDL library system for having me. And if you wanted to follow me on Instagram, you can find me at Purple Mountain PT. I hope everyone has a wonderful day. Bye-bye.
Thank you, Dr. Maureen. I had my mic muted for just a moment. I wanted to say thank you so much for your broadcast today with us. And I am sure that it will help lots of people. And
you're so sweet.
We look forward to working with you again soon. Thank you.
Thank you for having me.